7 service to make this available to everyone that actually needs it?
Minister.
I thank Ros McCall for that question, and I'd also like to commend the work that Ros McCall has been doing to really promote and explain the different symptoms that a stroke could, or the different symptoms that a stroke could result in. So I appreciate that very much. I'd like to say that the Scottish Government remains committed to introducing a high-quality and clinically safe thrombectomy service in Scotland. The delivery of a national thrombectomy service has already received over £26 million of investment, and through the National Thrombectomy Programme Board and Thrombectomy Advisory Group, work is being undertaken to drive expansion of the thrombectomy service. We expect additional spoke hospitals to begin referring appropriate patients for thrombectomies in the coming months, increasing geographical access to thrombectomy procedures.
Question number 5, Mark Griffin.
Thank you, Presiding Officer. To ask the Scottish Government what recent meetings it has had with neonatologists from NHS Lanarkshire.
Minister Jenny Minto.
Thank you. Scottish Government officials had discussions on the new model of neonatal care with neonatologists from Lanarkshire alongside neonatologists from other Scottish neonatal units at the recent Scottish Neonatal Consultants Group meeting. Senior Scottish Government officials also met recently with the Chief Executive and Medical Director from NHS Lanarkshire to discuss neonatal intensive care.
Mark Griffin.
Thank you, Presiding Officer. If the Government are relying on clinical advice which is now 5 years out of date, to downgrade Wishaw Neonatal Unit, it's shocking, it's absolutely shocking that the Minister hasn't taken the time to meet with the experts that run that unit. Will the Minister commit to meeting with the award-winning experts from NHS Lanarkshire Neonatal Unit before progressing with the plans to downgrade this absolutely crucial life-saving unit?
Minister.
I thank Mark Griffin for his question. I think it's important to recognise that the Best Start project started in 2018 and has really taken evidence from experts on the clinical side, and it is these experts whose advice we are following. Originally we had 8 neonatal units, that was reduced to 5, and then the next stage, which was reviewed in 2022, was down to the 3. I'm happy to meet with the unit at Wishaw General Hospital, and I think it's important, though, that officials continue to meet with the services there, and also parents that are involved in the service as well. We've also very much involved Bliss in all our work that we've been doing, and they represent parents from that have experienced this, what must be an incredibly traumatic time in their lives.
Thank you. Megan Gallagher.
Thank you, Presiding Officer. And to echo the comments that Mark Griffin has just made about this vital neonatal service in Wishaw General, parents and families who have used this service over the many years that the award-winning neonatal department has been opened are deeply distressed, deeply worried, deeply concerned that they will not be able to travel locally in order to get the care that they need for them and their babies. So will the Minister commit to making sure that she engages with families who have used this service over the many years to actually hear the life experiences and why this department is so important to them and their families?
Minister.
I think it's important to remind everyone that the neonatal unit in Lanarkshire will be remaining open and will be bringing the patients, the babies, back as soon as possible. We have made these decisions to ensure that the sickest and the smallest babies, the most vulnerable babies, get the best treatment ever, and we have based that on clinical evidence. As I've said to Mr Griffin, I'm happy to meet people within North Lanarkshire.
Question number 6, Alec Rowley.
Officer, to ask the Scottish Government what its response is to reported statistics showing that the number of people in Scotland dying from Alzheimer's and other forms of dementia has more than tripled in the last 20 years, and the concerns that the country is unprepared for the further expected increases.
Minister Marie Todd.
Firstly, our thoughts and condolences are with everyone who has lost a loved one. Scotland's new dementia strategy was published in May this year, setting out a 10-year vision for dementia policy. It recognises the importance of being able to access a timely diagnosis and post-diagnostic support that is right for them and for those who are caring for them. We'll soon publish our first 2-year delivery plan, developed in collaboration with people with lived experience, local and national partners, and this plan will include measurable deliverables to help us to achieve the ambitions of our dementia communities as detailed in our strategy.
Alec Rowley.
Thank you. I have read the strategy and I look forward to the delivery plan because I'm finding it difficult to see how we get from where we are now. I recently met with a group of carers in Dunfermline. What they described to me was the dehumanisation of care, a service that is in crisis. Community care is failing people up and down Scotland. So what's the plan to actually tackle the problems we have right now in social care?
Minister.
So we have invested over £6 million of ring-fence funding over the last 2 years for dementia post-diagnostic support. A significant further allocation for dementia PDS in 23-24 will be issued this year to IGBs. That's in addition to the estimated investment in dementia by health and social care partnerships of £2.2 billion, a 14% increase since 2014. And, as set out this week as part of our £1 billion NHS recovery plan, we'll reduce and address waiting times year on year for all conditions, including dementia. The social care system, of course, you will absolutely be aware. Derek Feely did an independent review of adult social care for us in Scotland and said that the system, whilst working well in many ways, is under strain. His recommendation was very clear. It requires, if we keep doing the same thing, we will keep getting the same outcome. And he made a very strong case for transformational change, which we are pursuing in the form of the National Care Service. And I look forward to Alec Rowley and Scottish Labour supporting us in that endeavour.
Thank you. And I call Christine Graham.
Thank you very much, Presiding Officer. I'll be brief. Can I invite the Minister to meet, as I have, dementia-friendly Tweeddale to learn of their work in supporting carers and those with dementia to continue to enjoy life and their activities after diagnosis and even add more?
Minister.
Absolutely. I'd be absolutely delighted. I recently visited a dementia meeting centre in Kirriemuir. It was a wonderful experience. I learned a lot from the people who were there, and I'd be more than keen to meet the people in the MSPs area. Thank you.
Thank you. That concludes general questions. Before we move to First Minister's questions, I invite members to join me in welcoming to the gallery His Excellency Mr. Miguel Berger, Ambassador of Germany to the United Kingdom. Thank you. The next item of business is First Minister's questions. At question number 1, I call Douglas Ross.
Thank you, Presiding Officer. In the last hour, Jamie Dawson, KC, counsel to the COVID-19 inquiry, has explained that the SNP government were asked to provide all communications related to key decisions made during the pandemic. These included all informal messages, including on WhatsApp. Mr Dawson has said, and I quote, "No messages were provided." Grieving families deserve answers and full transparency from this government. So why has Humza Yousaf not handed over key messages to the inquiry?
First Minister.
Can I say first and foremost that my thoughts continue to remain with all of those families that have been bereaved by COVID and affected by COVID. This government will cooperate fully with both the UK inquiry and the Scottish public inquiry. In terms of what we have released and what we will provide to the inquiry, let me make it clear that any potentially relevant information that we hold, be it in WhatsApp, be it in email, be it in any correspondence, we will hand over, have handed over. And of course, if there are concerns that have been raised by the inquiry, as Douglas Ross has rightly said, have been, then we will fully investigate them. we will, of course, hand over, and we have handed over relevant material. There are some messages that we're going to continue to provide, but they have to go through the appropriate processes. So we will continue to hand over those messages. We'll continue to cooperate fully with the public inquiries, both the UK inquiry and the Scottish inquiry. And for those concerns that have been raised, they will be fully investigated.
Douglas Ross.
I'm not sure what the First Minister is talking about. This is from this morning. Surely he is aware of what is happening. Jamie Dawson says the Scottish Government has provided the inquiry with no WhatsApp or other informal messaging material, either in its own possession or in the possession of the individuals whose individual Rule 9 requests are being handled by the Scottish Government. He also said there is no clear, comprehensive response emerged in the corporate statements from the Scottish Government. But in May this year, asked a direct question by a journalist, Humza Yousaf said if a request for messages, including WhatsApp, was made, the Scottish Government should be absolutely open and transparent. In June, he said in this chamber, and I quote, WhatsApp messages, emails, signal messages, telegram messages or whatever will absolutely be handed over to the COVID inquiries and handed over to them in full. The inquiry has heard this morning that that has not happened. So where are the messages? Where have they gone? And has the Scottish Government deleted any messages?
First Minister.
The Scottish Government did not make decisions through WhatsApp. That's not what we routinely did. I know that was very different to what was being intimated by the UK Government.
Members, let's hear the First Minister.
Routinely, decisions were not made over WhatsApp. And I have, and I will continue to say to every single government minister, every single government official, that we must comply with the inquiry fully. So if there is relevant information that has been passed on, I note the concerns that were raised this morning. Therefore, I've asked the Solicitor General just this morning to internally investigate whether there, of course, are any other messages that have to be handed over. So messages have been, whether it's WhatsApp, whether it's email, whether it's correspondence, all that information has been provided. I myself have provided a statement, of course, to the inquiry as well. But I do note the concerns that have been raised and can give an absolute assurance to the families listening, particularly those families that have been bereaved by COVID, where we hold any relevant information that will be passed on.
Douglas Ross.
But it's not. That's what we are hearing this morning. And it shouldn't take the Solicitor General to get involved. The First Minister must know what is required and must have heard, as I did, what the KC, the Council for the inquiry, has said. And despite, and I'm not going to say deliberately, maybe inadvertently, that the First Minister misled Parliament there, because we know, I think that's okay to say, because we know that SNP government ministers do routinely use WhatsApp to discuss government matters. At the end of last year, it was revealed that 4 SNP ministers were using WhatsApp to conduct government business. Neil Gray, Kevin Stewart, Marie Todd and Humza Yousaf himself. The Council to the COVID inquiry has also revealed today that witness statements, and this is a quote, suggest that informal communication, such as WhatsApp messages, were used by key decision-makers to discuss matters around the progress of the pandemic in Scotland and, this is a quote from the Council, decisions that the Scottish Government might have to take. And crucially, one Scottish Government official has voluntarily handed over WhatsApp messages from the pandemic, proving that they exist, First Minister. So there is no excuse for not releasing them. So why is this information being withheld from grieving families, the inquiry and everyone who deserves answers?
First Minister.
That is a complete mischaracterisation, and of course I did not inadvertently mislead the Chamber. I didn't say that there's never been discussions over WhatsApp. What I said is that we didn't routinely make decisions over WhatsApp, which was very different, of course, to what the UK Government has done.
Let us hear
what I
the
would
First
expect
Minister.
Scottish Government ministers to do, and Scottish Government officials to do, is comply with our mobile messaging apps usage and policy. That policy, I believe, I wrote to every single member of this Chamber, of this Parliament with. Now, what I'd also expect, of course, every single minister and government official to do is to, of course, comply with the Do Not Destroy notices that were provided by the UK inquiry. Now, there has been concerns that have been raised. Douglas Ross is absolutely right to reiterate those concerns that were raised on behalf of the committee. I can only say to the families listening that we will take on board those concerns. We will internally investigate fully, because my understanding, certainly as I stand here today, is that routine information relevant information, forgive me, has been passed over. But of course, if there is any concerns raised, they will be fully investigated, and I will ask the Solicitor General to investigate them. And of course, I will update this Parliament on any of those investigations.
Douglas Ross.
The First Minister was speaking about the letter he sent. I've got it here. On the 20th of July, he sent it to all MSPs. He states, "I should reiterate here that the Scottish Government is committed to openness and transparency. We are cooperating fully with both the UK and Scottish inquiries," which is totally the opposite to what we've heard from Jamie Dawson this morning. SNP members are saying no. The counsel to the inquiry has said they have not received what they asked for from the Scottish Government. And the Scottish Government does have record management policies requiring officials to retain records. The SNP business manager, George Adam, told this Parliament in December last year, this is a quote, "All recorded information that is held by ministers or officials that relates to the business of the Scottish Government is subject to freedom of information law, irrespective of its format or the platform on which it is held." The COVID inquiry also has powers to compel evidence. Refusing to hand over this information would not only be an insult to grieving families, it would not only be a shocking display of secrecy, it would potentially break the law. So will the First Minister confirm that he will be transparent and release every bit of information this government holds? And does he accept that if any messages have been deleted, it would be illegal?
First Minister.
It is not this government which has broken the law or will break the law. We will comply with not only the law, we will comply and cooperate fully with both the UK inquiry and also the Scottish public inquiry as well. And so we have passed over what we believe to be relevant information. That being said,
First Minister,
Douglas Ross is shouting
First
nothing.
Minister, if you might just give me a moment. Question has been put to the First Minister. Let's hear the First Minister respond with no other comment. First Minister.
Douglas Ross is saying nothing has been handed over. That is incorrect. My own statement to the COVID inquiry is over 100 pages long. So to suggest that there has not been any information passed over, that is simply incorrect. What we are doing and what we have done is not just complied with our own policy. What I'm seeking assurances on the back of this morning's comments from Council is to make sure that the DNDN notice, Do Not Destroy notice, has been fully complied with, not just by ministers, but by every relevant Scottish Government official. So we take seriously the concerns that have been raised by Council. This Government will undoubtedly fully cooperate with both the UK inquiry and both the Scottish public inquiry too.
Thank you. Question number 2, Anna Sarwar.
Thank you, Presiding Officer. In the past week, 2 major fires have brought misery and heartache to families who have lost everything. In Lochgelly, a fire ripped through a 4-storey block of flats, and in East Kilbride, 6 homes were destroyed. According to the FBU, both of these fires raged on because of delays due to cuts in services. And today, one firefighter has told the Courier that they were 15 minutes later than they could have been to a second fire in Fife, and that it is only a matter of time before these cuts put lives at risk. He said, "We all want to do our best by the communities we serve, but it's difficult when we have one hand tied behind our back." So, First Minister, why can't you see that these cuts are putting lives at risk?
First Minister.
Can I say to Anna Sarwar that first and foremost, let me pay tribute to each and every single one of our firefighters who do an incredible job in Scotland. I know that from my position, of course, as First Minister, but previously as Justice Secretary too. When it comes to Scottish Fire and Rescue Service, I don't agree about the point being made in relation to cuts, because despite the very difficult financial circumstances due to UK Government austerity, we're providing SFRS with more than £368 million this year. That's an increase of £14.4 million on 22-23. If I look at how many firefighters we have in comparison to other parts of the UK, as of March of last year, there were 11.3 firefighters per 10,000 of the population in Scotland. That compares to 6.1 in England and 8.4 in Wales. If I look at the pay, I'm pleased to say that firefighters accepted an improved two-year pay offer of 7% for 22-23 and 5% for 23-24. And when it comes, importantly, this I think is the most crucial statistic for the public who are interested in their safety, that of course between 2011, 2012 and 2021-22, over that 10-year period, the number of recorded fires has dropped by 14%. So we continue to invest, increase in fact the investment in the Scottish Fire and Rescue Service. We continue to have more firefighters per head than other parts of the UK, but crucially fires are going down because of the investment that we've made.
Anna Sarwar.
In short, Presiding Officer, the First Minister is saying firefighters are wrong and he's burying his head in the sand. The fire service budget is set by the government and it has fallen by 22% in real terms over the past decade, and the Chief Fire Officer has been clear where the service is headed. He has said that 780 firefighter posts, between 20 and 25% of the workforce, could go if the government doesn't change course. He went on to say that this would impact on response times. When fighting fires, every second counts. So why does the First Minister think he knows better than firefighters on the ground and the Chief Fire Officer about how to keep people safe?
First Minister.
What I'm saying to Anna Sarwar is that as a government, we have, of course, increased our investment in the Scottish Fire and Rescue Service. That's a fact. This year, we've increased the funding by 14%. We have more fire officers per head, per 10,000 of the population, than other parts of the UK. And crucially, fires, the number of fires, the incidence of fires, are going down. And that is what, of course, the public care most about. And I will also quote Chief Fire Officer David Ferries, because Anna Sarwar is right, there are changes being made, there are reforms being made in relation to the Scottish Fire and Rescue Service. And in relation to those reforms, Assistant Chief Fire Officer David Ferries said, and I quote, "We're trying to make sure we get a fire service that is fit for the communities of Scotland in the future. This gives us an opportunity to rebalance and reshape the service in a way that meets the 21st century." And I think that's absolutely right. So I trust the Scottish Fire and Rescue Service to make those changes and do so in a way that continues to keep people safe. I'm not sure why Anna Sarwar doesn't.
Anna Sarwar.
Trusting firefighters. I think it's me that's standing up here and speaking for firefighters who are camping out this Parliament rather than the First Minister. Perhaps he wants to go outside and talk to them. A 22% fall in real terms. This government's financial mismanagement is already affecting every part of a fire service that is suffering from a decade of neglect. In the past 10 years, hundreds of firefighters have been lost, and now a dozen appliances are being removed, and the First Minister is ignoring warnings that his government is putting lives at risk. In the last few months alone, these changes have affected fire stations in every corner of Scotland: Dundee, Greenock, Dunfermline, Glenrothes, Methil, Perth, Hamilton, Kirkcaldy, Edinburgh and 4 in Glasgow. If that's not cuts, First Minister, what is? When the single fire service was created, the SNP said that it would, and I quote, "not result in cutting frontline services." What was that, SNP spin or SNP incompetence?
First Minister.
Let's again, instead of sticking to the spin that Anna Sarwar is continuing to articulate, let me stick to the facts. The facts are that since 2017-18, there's been substantial year-on-year increases in funding to support the Scottish Fire and Rescue Service. On top of that, we have more firefighters per head, per 10,000 of the population, than other parts of the UK. Of course, fires are going down. In terms of the temporary withdrawal of appliances, and Anna Sarwar is right, there has been a temporary decision to withdraw some appliances. My understanding is that's 10 appliances of their 635 operational appliances. That's 1.5%. And when I look at what the independent, His Majesty's Chief Inspectorate of Fire and Rescue Services has said, they've provided absolute assurance that the SFRS temporary changes are based on a robust analysis of activity levels, historical demand, and importantly, the ability to supplement any initial response within, and this is the crucial bit, an acceptable timeframe. So we continue to invest in our fire service, and I want to thank and pay tribute to the FBU, to our firefighters on the ground, and I'll continue to give them a promise that so long as we are in government, we'll continue to ensure that they get the investment that they need to keep our public safe.
Question number 3, Alex Cole-Hamilton.
Officer, to ask the First Minister when the Cabinet will next meet.
First Minister.
Tuesday.
Alex Cole-Hamilton.
Vast numbers of people are being forced to call emergency dental helplines because they can't find an NHS dentist. An investigation I'm publishing today shows that that happened almost 16,000 times last year in Fife alone. Now, that's hardly surprising, given that there is just one Fife practice accepting new NHS patients. Across Scotland, people are desperate. Some are even resorting to DIY dentistry. The First Minister's recovery plan promised to abolish NHS dentistry charges altogether, but they're not going away. Next week, they're going up. Some will even double. And what the government didn't tell you is that there are new charges for those emergency appointments and things like denture repairs. So can I ask the First Minister, why are people paying more for less under the SNP?
First Minister.
Well, first of all, of course, the word that Alex Cole-Hamilton did not mention in his question, was the word pandemic. There has been a significant impact because of the pandemic on our dental services, not just here in Scotland, but right across the UK. Alex Cole-Hamilton was also incorrect in saying that we haven't made progress in relation to removing dental charges. We have done so for young people, for those that are under the age of 26, and we, of course, look forward to making continued progress. In terms of growing the NHS dental workforce in Scotland, we have 55 dentists per 100,000 of the population. That's compared to 43 per 100,000 in England. So we are investing in our dental services, in our NHS dental services. I'm more than happy, and the Cabinet Secretary will be more than happy to write to Alex Cole-Hamilton with details of the progress that we have made. And crucially, when it comes to the oral health of our young people in particular, where I know all of us have an interest, there has been significant progress as well. It will, of course, take time, but what I can absolutely guarantee is not just the public, but those working in our dental sector right across Scotland, is that we'll continue to invest in dentistry here in Scotland so we can continue to improve outcomes for patients right across the country.
Question number 4, Claire Hawley.
To ask the First Minister, in light of the launch of Scotland's new HIV anti-stigma campaign in partnership with the Terence Higgins Trust, what action the Scottish Government is taking to eliminate new transmissions of HIV?
First Minister.
Well, we are delighted to partner with the Terence Higgins Trust, other HIV stakeholders, in this important anti-stigma campaign. Tackling stigma is one of the many ways to address HIV transmission in Scotland by reducing barriers to testing and treatment, as well as improving the lives of people living with HIV. We remain absolutely committed to eliminating HIV transmission in Scotland by 2030. Our HIV transmission elimination delivery plan, developed by the Deputy Chief Medical Officer and stakeholders, will prioritise the recommendations for HIV elimination that we published last year. Our aim is to publish this plan in the coming months.
Claire Hawley.
I thank the First Minister for that answer. Stigma often presents a barrier to people accessing HIV testing, and this anti-stigma campaign is an exciting milestone in Scotland's mission to improve the lives of those living with HIV and to update public attitudes. A first of its type in the UK, the campaign will reflect the realities of living with HIV in Scotland today, where if an individual is on the right treatment, they can live a long, happy and healthy life and cannot pass the virus on to others. Does the First Minister agree with me that tackling stigma around HIV will help Scotland reach zero new transmissions of the virus and will improve and save lives?
First Minister.
Well, I do absolutely agree with Claire Hawley on that point. Tackling stigma is absolutely fundamental to achieving our HIV transmission elimination goal by 2030. The campaign that I referenced and that Claire Hawley referenced in our original question is just one way of addressing that stigma. We're also working with NHS Education Scotland to produce training materials for non-HIV specialists in the NHS to improve the detection and diagnosis of HIV. We're also working with Waverley Care to support fast-track cities, which provide stigma-related training activities for the health and social care workforce. Almost half the people in Scotland, almost half of the population in Scotland would be ashamed to tell other people that they were HIV positive. So work is still required, very much required, to challenge misconceptions, while also improving access to testing, to preventative treatment, and also to support people living with HIV. And these will be prioritised in our HIV transmission elimination delivery plan.
Carol Mockin.
Thank you, Presiding Officer. Can I say that this new partnership is welcome and we must do all we can to eliminate new transmissions of HIV. Therefore, can I ask the First Minister for a progress update on commitments made by the Scottish Government on World AIDS Day 2022, including the pilot of an e-PrEP clinic, which would act as an important and significant step towards ending stigma and giving people greater control over their own health care?
First Minister.
I will ensure that the member. I will ensure that we write to the member with full details in terms of an update. But Scotland has been world leading in the implementation of HIV pre-exposure prophylaxis PrEP since the introduction of our programme in 2017. We do have to recognise, and the point is well made by the member, that PrEP has to be as accessible as possible to communities and for those who require it in communities up and down Scotland. Work is underway, very much underway, to pilot the online PrEP clinic. £400,000 of funding has been provided for the development of this project, which is currently in the important development stage and is on track to be taken forward during 2024 and beyond. But I'll ensure a fuller update is provided to the member.
Question number 5, Megan Gallagher.
Thank you, Presiding Officer. To ask the First Minister what the Scottish Government's response is to reported concerns that parents are having to give up their jobs due to childcare costs.
First Minister.
Early learning and childcare plays a crucial role, not just in children's development, but in helping parents, particularly mums, to return to work. Our current offer is, of course, the most generous in the UK, with all 3- and 4-year-olds and around a quarter of 2-year-olds entitled to 1140 hours of childcare each year. Independent research shows that 88%, almost 9 out of 10 parents with a 3- to 5-year-old, were satisfied that they could access childcare in a way that meets their specific needs. But I do recognise we have to, of course, go further to support more parents to find or indeed to stay in work. That's why in the programme for government that I set out my plans to improve the childcare offer, to expand the childcare offer, to work with our partners to help 13,000 more children and families access that childcare by the end of this Parliament.
Megan Gallagher.
Presiding Officer, childcare costs are one reason why so many women choose not to start a family. Families with children are having to cut down on essential items because they cannot afford to work and pay for childcare. This is why the rollout of free childcare is so important. It's not a luxury, it's a tool to get parents into work and our economy moving. So given the Scottish Government have not announced anything on childcare since the programme for government, how will he reassure women that they won't end up pregnant, then screwed by this government?
First Minister.
Wow.
The programme for government, of course, was just last month, and I'm more than happy to provide an update to Megan Gallagher as we make substantial progress. I go back to the point, of course, that in Scotland we have the most generous childcare offer in the UK. What I would also say is one of the important points that I mentioned in my programme for government is, of course, the sustainability of the PVI sector. And Scotland is the only part of the UK to pay staff who are delivering funded ELC the real living wage. We're committed to providing the necessary funding to increase pay to £12 an hour for staff who deliver funded ELC provision in the private, voluntary and independent sector. So we are investing in that most generous childcare offer. I'm sure other governments in the UK might want to follow Scotland's lead.
Martin Whitfield.
I'm very grateful, Presiding Officer. The First Minister will be aware that the data that was produced by Pregnant Then Screwed campaign is damning. So does the First Minister share the confidence that the Scottish Government ministers do that the private sector childcare nursery model is still viable, even with the proposed Scottish Government funding?
First Minister.
I did see that report, and I want to thank Pregnant but Screwed for the information they provided in the report that they have done. That is why I was keen to put on record that we do recognise that our challenges, particularly in the PVI sector, I think we all recognise that in our conversations with the private, voluntary and independent sector. That's why we are going to be providing, and we will be providing funding to increase pay to £12 an hour for staff who deliver ELC provision. But I do go back to the point that I made to Megan Gallagher a moment ago, that through independent research, and I stress the word independent, that shows that 88% of parents with a 3 to 5-year-old were satisfied that they could access childcare in a way that meets their needs. But I do recognise the point the member raises about the sustainability of the sector. And that's why I am absolutely committed to work with the PVI sector to ensure that we have a sustainable ELC provision going forward.
Willie Rennie.
I'm afraid what the government's done so far on the PVI sector isn't enough. I think the First Minister knows there's an exodus of experienced staff from the private and voluntary and independent sector. And he can't just do the £12 an hour living wage. He needs to increase the fee rates, or we're going to have a sector that's just not sustainable. He promised that in the leadership contest. Is he going to deliver?
First Minister.
Again, of course, we will update the Parliament in terms of our plans around the budget, of course, in due course at the end of this year. It's fair to say that overall capacity of the number of registered places across the whole childcare sector remains stable and has remained stable between March 2020 and March 2023. And we know from the delivery data that we collect from Council specifically, the number of hours that services offer has increased. But I do take the points that there are challenges around the sustainability of childcare. That's why we will continue to invest, continue to ensure that we have the most generous offer than anywhere else in the UK.
Question number 6, Jackie Bailey.
To ask the First Minister what steps are being taken to eradicate long waiting times for NHS treatment in light of Public Health Scotland data showing that over 1,500 patients have waited more than 3 years.
First Minister.
Well, excessively long waits are, of course, unacceptable. We're working hard to drive down those longest waits, and we've already seen a significant reduction since targets were announced last July. The latest Public Health Scotland data shows that 73% of inpatient day case specialities had less than 10 patients waiting more than 3 years, and only 8 had 10 or more. This is welcome progress, but there's undoubtedly more to do, which is why in each of the next 3 years we will provide an extra £100 million to accelerate treatment for patients and reduce inpatient and day case waiting lists by an estimated 100,000 patients. This investment will allow us to maximise capacity, build far greater resilience into the system and deliver those year-on-year reductions in the number of patients who have waited far too long for treatment.
Jackie Bailey.
Let's talk about people, not percentages. And it is true, in July last year, the First Minister announced a series of targets for completely eradicating long waits for treatment by September 2022. Not a single one of those targets has been met. In fact, instead of being 0 as promised, there are a shocking 6,831 Scots waiting more than 2 years. His recent announcement of £300 million over 3 years is expected to treat 100,000 people. The waiting list sits at 800,000 people, and it's growing. Both the BMA and RCN have been scathing about the total failure to acknowledge the workforce crisis, and even his own economy minister admitted that they had no idea how it will all be funded. So, Presiding Officer, when will the First Minister end the 800,000 people on the waiting list? And in light of the SNP's failure to deliver on existing promises on waiting times, why should patients believe them now?
First Minister.
Again, Jackie Bailey, of course, does not acknowledge the impact that the global pandemic has had on health services right across the UK. Of course, in Scotland, but in health services right across the United Kingdom. And of course there are differences in how we record waiting times right across the UK. Waiting times in England and Wales, they're measured by referral to treatment time. That's the 18-week target, which, as I say, they're not directly comparable to Scotland's treatment time guarantee. But nonetheless, when we look at the data from the 30th of June this year, it shows that there was 122 patients waiting per 1,000 of the population for the treatment time guarantee and new outpatient appointments here in Scotland. So that's 122 per 1,000. That's fewer than in England, where 134 patients per 100,000 per 1,000 are on the RTT waiting list, and in Wales the figure is 243 per 1,000. My point is, while acknowledging there are differences in ways that those figures are measured, that the global pandemic has impacted health services right across the UK. We have made significant reductions. The numbers waiting over 2 years for new outpatient appointments is down by 59% when it comes to those waits of over 2 years. And when it comes to those people who have been waiting as inpatients for longer than 2 years, then that has reduced also by 28% since targets were announced. So we'll continue our record investment in the NHS. We'll continue to ensure that our staff is at historically high and record levels. And we'll continue to make sure, of course, that our NHS staff remain the best paid anywhere else in the UK.
Sandesh Gulhani.
Given the unacceptably long secondary care wait times, desperate patients are forced to continue to see GPs, placing greater strain on primary care and taking up appointments, forcing new issues from patients to wait, leading to them going to A&E in desperation. This is a system-wide cycle of despair that has contributed to record deaths this winter. You've spoken about surgical waiting times, but what about our patients waiting for medical clinics, chronic pain management, respiratory or cardiology? What tangible changes are you making specifically for them?
Always through the chair, please, Mr Gulhani. First Minister.
Well, first and foremost, that is exactly why we're investing an additional £300 million to reduce waiting lists for patients that have been waiting far too long. But Sandesh Gulhani asked the question, what are we doing? We're doing everything we possibly can. Our NHS staff are doing everything they possibly can to increase activity in order to aid the recovery. I'll give you one example. I'll give Sandesh Gulhani one example of that. When we look at inpatient day case activity for Q2, it was the highest since the start of the pandemic. In fact, it was the 6th quarterly increase in a row, with 58,813 patients being seen in Q2. So we are increasing the activity, but what we are also doing is making sure that we increase the workforce where we can. So we have had recently historically high levels of NHS staffing. We're making sure that they continue to be the best paid. And of course, what will help us in relation to that NHS activity is to make sure that no NHS worker, be it a doctor or a nurse or any of our NHS staff, feels like they have to go on strike because they're not being fairly paid. So this government will continue to make sure that our NHS staff are the best paid in the whole of the UK.
Thank you. We move to general and constituency supplementaries, and I call on Rona Mackay.
Thank you, Presiding Officer. Can the First Minister outline how the newly announced Fund to Leave will support women fleeing an abusive relationship?
First Minister.
The new £500,000 Fund to Leave pilot will help reduce the financial burden on women who can receive up to £1,000 to pay for the essentials that they and their children need, for example, for rent, be it for clothing. The fund is to support women experiencing domestic abuse who, as we all know, face many challenges, many difficulties, including financial barriers when they plan to leave abusive partners. It is vital that women are able to access the support that they need when they need it. And this can be through local authorities, their local women's aid group, or indeed partners involved in delivering the fund. I would always urge any women experiencing domestic abuse or violence to reach out for support available through Scotland's Domestic Abuse and Forced Marriage Helpline.
Thank you. Russell Finlay.
Thank you, Presiding Officer. Claire Ingalls was tortured and murdered in her own home, leaving behind a young son. Fiona and Ian Ingalls have found the strength to be here today, 24 hours after their daughter's killer was jailed. They are here for answers. Why was a violent criminal with dozens of convictions granted bail not just once or twice, but 5 times? And since Claire's murder, why has the SNP government passed a law that will make it even harder to remand criminals in custody? And will Humza Yousaf commit to an independent, robust and transparent inquiry?
First Minister.
First and foremost, my thoughts are very much with Ian and Fiona, the parents, Claire's parents. I cannot imagine the trauma and the grief that they are going through. There cannot be anything more unnatural in this world than to have to bury your child. So I extend the condolences and the sympathies of this government to Ian and Fiona. I will, forgive me, President Officer, with your indulgence, take a bit of time to answer some of the questions that Russell Findlay has posed on behalf of the family. First and foremost, it is appropriate for me to say that, of course, decisions about bail and remand are for the independent judiciary. They're for the independent courts to determine. They are not for the First Minister or indeed any government or indeed any politician to interfere in or intervene in. In terms of the Bail and Release Act, I do not agree with the characterisation Russell Finlay's characterisation. When I look at the Bail and Release Act, it is, of course, for the first time that the Act makes clear that the court should specifically consider victim safety, which includes both physical and psychological harm, when applying the new bail test. So that is for the first time explicit within the Act. So victim safety is absolutely at the heart of any decision that should be made around bail and remand. In terms of an independent inquiry, as Russell Finlay has asked for, he knows that I cannot intervene or interfere in the decisions of the judiciary, given the concerns that have been raised by Russell Finlay, that have been raised by Ian and Fiona. I will, of course, convey those concerns directly both to the Lord President and indeed the Lord Advocate when it comes to prosecutorial decisions and decisions to either oppose or accept bail conditions. It will be for them to, of course, appropriately respond, but I cannot demand an investigation into a decision that has been made by the independent judiciary, or certainly it would be unwise for me to do so, because that would be seen undoubtedly as interference with a decision made by the independent judiciary. I will end by saying that this dreadful case, this tragic case, reminds us of the need to do more to tackle not just domestic abuse, but indeed domestic homicide. And that's why the Scottish Government is committed to developing a multi-agency domestic homicide review model in partnership with key stakeholders, which I will give more information to Russell Finlay and to any other member that has an interest.
Mercedes Vialba.
I remind members of my register of interest as a member of Unite the Union. Today it was announced that Newman Bonar, the company set up earlier this year to acquire historic Dundee textile manufacturer Bonar Yarns, is closing, risking the livelihoods of 57 workers and their families. Can I invite the First Minister to take this opportunity to join the provisional liquidators in asking that any party who has an interest in acquiring the business please contact them? And will the First Minister join me in fighting to save these important manufacturing jobs in Dundee?
First Minister.
I do share Mercedes Vialba's clear disappointment to hear that Newman Bonar Limited has gone into liquidation. My immediate thoughts, of course, are with the staff and with their families, who are again going through further uncertainty. The Wellbeing Economy Secretary had met with and written to the company in recent months to encourage it to fully engage with Scottish Enterprise so that every available option to save the business could be explored. I know the business has had a long-standing presence in the community, of course, as an important local employer, and we will certainly do everything we can in our power to protect jobs and the manufacturing footprint in Dundee. Scottish Enterprise is engaging directly with the liquidator to better understand the situation given last night's announcement, and we, of course, as a government, stand ready to provide support to any employees who are potentially facing redundancy through, of course, our partnership action for continuing employment pace, and I'll keep the member updated on how those conversations are going.
Maggie Chapman.
Apologies, Presiding Officer. Thank you. This week, the FBU Scotland launched their Firestorm report. In the last 7 days, we've seen them tackle floods and flames. Our fireys are gathered outside right now, and they are clear. They cannot continue in their current roles, never mind adapt to the future kinds of roles they are expected to do with the current levels of investment. Can I ask the First Minister what his response to their Firestorm report is, and will he agree to meet with firefighters themselves, not their managers, frontline firefighters, to hear directly their concerns?
First Minister.
First and foremost, I go back to the response to Anna Sarwar. We will continue to ensure that we invest in our fire service because they do an incredible job, and of course in our firefighters, who we have a regular dialogue with the FBU. In fact, I think the Cabinet Secretary has committed just this morning to meet with the Fire Brigades Union to meet directly with those on the front line. We did, of course, this financial year increase SFRS's budget by £14.4 million. That's despite the current financial pressure that we are under. On top of that, of course, we continue to make investments in the Scottish Fire and Rescue Service that has seen them, through their incredible hard work, reduce the number of fires that have taken place over the course of the last year. So I do have the Firestorm report. I have read through the report, and of course the Cabinet Secretary will meet with the FBU as she committed to this morning.
Christine Graham.
Thank you, Presiding Officer. First Minister, under the Scottish Government's vaccination programme, I recently had both the COVID and the flu vaccines at a very busy, efficient and indeed friendly vaccine centre. But that's anecdotal. So can I ask for an update on the take-up of the vaccine, please?
First Minister.
Christine Gray makes an incredibly important point. Of course, we know that the vaccine and vaccines, both for COVID and flu, are incredibly effective and important. I would encourage anybody who's eligible to come forward for those vaccines. The programme is progressing very well, with over 1.7 million vaccines administered so far. That's over 1 million flu vaccines and almost 700,000 COVID vaccines. For those at our highest risk, our rephasing of the programme has resulted in 73% of care home residents already vaccinated, with the remainder due for completion by the end of this month. A large number of people have appointments throughout the rest of October and November, with vaccines due to be delivered by early December. I would say to everybody, I would reiterate to all of those who are eligible that getting the flu vaccine, getting the COVID vaccine could save your life. It is the safest and most effective way to protect yourself and the NHS this winter. So if you are eligible, please do, but are yet to book an appointment, please do so. I encourage everybody who's eligible to get those vaccines.
Miles Briggs.
Thank you, Presiding Officer. This week I met with campaigners to discuss the impact of lockdowns on families of those living in care homes. After a long campaign, it was welcome that the Scottish Government announced that they would implement Anne's Law. However, there are concerns that that still hasn't taken place, and it's currently sitting within the National Care Service Bill. Campaigners want to see it decoupled. So can I ask the First Minister if he will agree to meet with the campaigners, and if ministers will look urgently at decoupling Anne's Law and delivering it now?
First Minister.
Of course, through changes that were made by the previous Minister for Social Care, Kevin Stewart, of course, you gave practical effect through regulation to Anne's Law. That notwithstanding, of course, if there's something else we can do, and the suggestion being made by Miles Briggs in relation to decoupling, I will consider. But, of course, we do have the National Care Service Bill progressing. Of course, we took time to pause that due to concerns that were being raised by local authorities and by trade unions. And, of course, I will ask the Cabinet Secretary to meet with Miles Briggs and, indeed, with the families who are represented by those who are in care homes to see if there's anything further we can do.
Bill Kidd.
Thank you, Presiding Officer. As we mark Care Experience Week, can the First Minister provide an update on the steps the Scottish Government is taking to improve the experiences and outcomes for looked-after children as they transition to adulthood?
First Minister. I do think every single member of the Scottish Parliament who has met with care experienced people, particularly care experienced young people, will have been moved by their plight, by their strength, by their advocacy. And I had the great privilege to meet with a group of care experienced young people in Glasgow yesterday, and I heard about some of the challenges that care experienced people face during that transition into adulthood. And for anyone moving away from home can be a challenging time when we rely heavily on our family support networks, but not everybody has that family support network. Not everybody has the luxury of their mother and their father, or indeed wider family, to be able to rely on. And that's why I was pleased to set out the Government's proposal for a £2,000 care leaver payment to provide financial support at such a pivotal moment in young people's lives as part of a broader package of support. This is a key step in keeping the promise, and let me reiterate to the Chamber today that I, as First Minister and this Government, fully intend not just on keeping the promise, but making sure it's delivered.
Thank you. That concludes First Minister's questions. Point of order, Sandesh Gulhan.
First, just to declare my interest as a practising NHS GP.
Thank you, Dr Gulhani. Your comment has been recorded. The next item of business is a members' business debate in the name of Paul Sweeney, and there will now be a short suspension to allow those leaving the chamber and public gallery to do so before